Right, Chairwoman Ann Floyd Huggins, we are now live and you have the floor.
All right. Good afternoon to all of our citizens who are listening to us today. We welcome you to this emergency meeting of the Pitt County Board of Commissioners and the Pitt County Board of Health. This is a meeting to update us on the distribution of the vaccine for COVID-19. At this time, I call the meeting to order. Madam Clerk, will you call the roll?
Yes, Chairwoman Floyd Huggins,
Yes, present.
Vice Chair Fitzpatrick,
Yes.
Commissioner Albright,
Here.
Commissioner Colson,
Yes.
Commissioner McLaughlin, Commissioner Nunnally,
Yes.
Commissioner Ward,
Yes.
Commissioner White,
Here.
Commissioner Perkins Williams.
Here.
All Board of Commissioners are present, and I believe their secretary for the Board of Health is going to do their roll call.
All right, we'll do that at this time, please. Madam
Thank you.
Secretary.
Thank you. Chairman Adam Harrell,
Present.
Vice Chair Tina Dixon,
Present.
Dr. Herbert Garrison,
Present.
Scott McIntosh,
Present.
Kelly Pack-Smith,
Present.
Lowell Spate,
Present.
and members for the Board of Health who are not present are Martha Engelke, Rex Fleming, Mark Hayes, Natish Patidar. Thank you. That is all.
Thank you, Madam Secretary. As I said, the purpose of this meeting is to get the distribution rollout for the vaccine for COVID-19. And I believe I'm going to start with Dr. Sivernell. Would you like to start first?
Yes, Madam Chair, I have a prepared remarks and presentation for you. And with your permission, I will go ahead and deliver that.
Do so, please.
There we go. Let me just minimize that on my screen. Good afternoon, Board of Commissioners. Good afternoon, Board of Health. I know many of you have questions about what we have done with the COVID vaccine so far. At the manager's request, I have prepared a presentation to inform you on how we have handled this and where we are going with this. Some opening remarks regarding the COVID-19 vaccine. Supply does not equal demand for all vaccine candidates in phase 1A. Supply does not equal demand for all vaccine candidates in phase 1B, group 1, which means those individuals over the age of 75. Pitt County Health Department and Vidant Health are currently the only entities in Pitt County receiving and authorized to provide vaccine to Pitt County residents. Pitt County Health, Vidant Health, and other local medical providers have been having weekly meetings to discuss the delivery and distribution of COVID vaccine to approved groups in Pitt County. The prioritization of vaccine candidates has been established by the North Carolina Department of Health and Human Services. As part of the provider agreement we signed with the North Carolina Department of Health and Human Services, we must adhere to this prioritization schedule. The movement through the prioritization levels is at the discretion of the Department of Health and Human Services, the state Department of Health and Human Services. And I will say that this guidance has been something of a moving target at times. I apologize for the font on this screen. I wanted to make sure that this was presented exactly as it came to me from Dr. Tilson. So this was cut and pasted from a letter that I received and all health directors received from Dr. Tilson last week. That letter was also provided to you, commissioners, in your packet. If it was not provided to the Board of Health, I will see that the Board of Health gets this as well. This is the COVID-19 vaccine phase 1B prioritization list. This is divided into 3 groups. Group 1 includes anyone over the age of 75. Group 2 includes healthcare workers not vaccinated as part of phase 1A, and frontline essential workers 50 years of age or older. The ACIP, or Advisory Committee on Immunization Practices, which is a CDC, a federal committee of the CDC, defines frontline workers as those whose job is essential for COVID-19 response and who work in a setting that puts them at risk for being exposed to COVID-19. This includes first responders, for example, firefighters and police officers, corrections officers, food and agricultural workers, U.S. Postal Service workers, manufacturing workers, grocery store workers, public transit workers, education and childcare workers, meaning teachers, support staff, and daycare staff. Group 3 includes healthcare workers not vaccinated in phase 1A and frontline essential workers as defined above of any age. The state provided us with an estimated timeline. This hinges heavily on available supply of vaccine. So this again is taken directly from Dr. Tilson's letter to the local health departments. These timeframes are estimates only and subject to change based on the supply North Carolina actually receives from the federal government and local supply. Vaccine providers may begin as early as these dates. January 6th, 2021, open to phase 1B, group 1, and continue 1A. Some vaccine providers may begin as early as January 6th, excuse me, but we expect most vaccine providers will begin on January 11th. January 20th, 2021, open to phase 1B, group 2, and continue all previous groups in 1A. February 8th, 2021, open to phase 1B, group 3, and continue all previous groups and 1A. Unless someone has questions at this point, I'd like to move on and talk about our vaccine operations to date. We received our first allotment of vaccine on December 23rd, 2020. There was some question of whether it would arrive on Wednesday or Saturday, but it did arrive Wednesday morning. We were able to vaccinate 18 staff members and 2 dignitaries that day. The dignitaries included Greenville Fire Rescue Chief, Chief Eric Griffin, who volunteered to be photographed as one of our first vaccinee. In fact, he was the first vaccinee. And Board of Health Chair, Dr. Adam Harrell. As the chairman of the Board of Health, Dr. Harrell is the highest ranking public health official in Pitt County. Work was begun at that time on a schedule to provide vaccine to Group 1A eligible medical staff, including EMS staff, not eligible to receive vaccine through Vidant Health. Vaccine clinics for these individuals began operating on 12/30/2020 with a daily capacity of 80 individuals per day. We felt to start with that was what we could comfortably handle given our spacing and social distance requirements. We think we could push that a little bit higher, perhaps as high as 100 individuals per day, provided we had vaccine supply to support that. This week, Group 1A vaccine candidate clinics are scheduled Monday through Thursday. Friday was held as a potential day for long-term care vaccinations. I'll tell you more about that as the presentation progresses. This week, 2 mobile EMS provider clinics were held with the assistance of Dr. Robert Portella, the Pitt County EMS Medical Director, and Jim MacArthur, paramedic and Pitt County Emergency Management Deputy Director. Those I've not heard completely about today's clinic. He was very successful in Farmville on Tuesday, where he did 61 vaccinations. And then he was going to, I believe, Winterville and Simpson today to get the South and the East. And we gave him a supply of 70 vaccines going out the door this morning. To date, we have received 1,400 doses of Moderna vaccine. By the end of clinics today, we will have administered nearly 700 doses of that vaccine. We have additional Group 1A providers scheduled for next week. We still have 290 long-term care patients that we are responsible to vaccinate, plus the staff at these facilities across Pitt County. That encompasses about 40 facilities.
I can't get that, Phyllis.
We will use a portion of our available stock vaccine next week to begin phase 1B, Group 1, on Monday. Our call center has had contact with 80 Pitt County medical facilities seeking vaccine. A number of local medical providers have reached out to me directly in regards to vaccinations. Vaccine stewardship. The Moderna vaccine is packaged 10 doses per vial. It is very stable in the freezer at normal freezer temperatures. Once it's thawed, it can be stored at normal refrigeration temperatures and remain stable for 30 days. Once a vial is opened, it must be used within 6 hours. So we have tried to be very careful in booking appointments in groups of 10. Some vials are overfilled. This is something that we learned after we received the vaccine. That overfill allows, in some cases, 11 doses to be withdrawn from a vial that is described as containing 10. So that's a good thing. We've actually gotten a few extra doses out of some of the vials. We're trying to keep a few eligible vaccine candidates on standby, providing an available recipient if we do have leftover doses. Our no-show rate for vaccines has been pretty low, but there have been a couple of days where we've had leftover doses, and rather than waste them, we've tried to keep a few people who wanted it and were willing to wait on standby for it so that we could administer those doses and not have to waste them. I'm happy to report to you that to date, we have not wasted any COVID-19 vaccine doses. So every vial that's been opened, every dose has ended up in a appropriate person's arm. Want to talk to you specifically about phase 1B, Group 1. These are the individuals that are 75 and over. On December 30th, 2020, the North Carolina Department of Health and Human Services held a call with local health directors announcing a change in the prioritization strategy and advising us that we would be moving to phase 1B. This was in part based on a change at the federal level in the ACIP, the Advisory Committee on Immunization Practice guidance that forced the state to make a change in its guidance. We were advised that this transition could happen as soon as January 6th, but for most should happen on January 11th, 2021. Written guidance for the new prioritization was received on the afternoon of 2020, not 2021. On Monday, 1/11/2021, Pitt County Health Department will make available 224 doses of COVID-19 vaccine for individuals 75 and over. This will be done by appointment only at the Agricultural Center. Please see our press release that went out earlier today for details. And I will mention, while I do not speak for Vidant Health, Vidant will also be making a limited number of vaccines available to this group next week. Amy, would you like to comment on the operation on Monday while we're on this slide?
Sure. I just left the hotline room just before this call, and we are probably full. All those 224 doses have probably now been reserved. We just had a few slots left. We will be running all day beginning at 9 a.m. until 4 p.m. And we are doing about 8 individuals every 15 minutes. And we have ample staff to do that. We're also using some volunteers through the College of Nursing, some retired nurses to help us with this, since we do not have enough staff to do a site at the Ag Center, as well as a clinic that we're also holding here for healthcare workers at the same time. But we're ready to roll on Monday morning.
Thank you, Amy.
Mm-hmm.
we did not expect this transition to happen until the first part of February. So we're a little ahead of schedule in moving into this group. Want to move on and tell you about our ongoing efforts to improve and expand the delivery of COVID-19 vaccine in Pitt County. I have been working with the ECU Health Science Division to develop some mobile teams to help support vaccination efforts in Pitt County. Dr. Paul Shackelford, who some of you may have known, Paul's a notable gynecologist here in Greenville, was with ECU, then in private practice, and then for a number of years was the Senior Vice President of Medical Affairs at the Medical Center. Paul is now back with ECU, and we have an agreement in principle for this project. This will use faculty, staff, and potentially students to create teams to help us with the delivery of vaccines throughout the county. To begin with, we will use these teams to vaccinate approximately 290 residents of the 40 long-term care facilities we have responsibility for. Most of these facilities are small to medium-sized facilities, some as small as 4 beds, most of them in the 10-bed range, probably none larger than 20 beds. The larger facilities, there are actually 61 facilities in Pitt County. The larger facilities are enrolled in the federal vaccine program and will receive vaccine through one of the chain pharmacies, either Walgreens or CVS. This project will also include eligible staff from these 40 facilities will receive their vaccinations as well. And moving forward, we hope to use this model to reach other eligible groups and some of the more rural areas of Pitt County as vaccine is expanded more broadly. Biden Health, Pitt County and Biden Health are working together to expand vaccine availability as allowed by North Carolina Department of Health and Human Services. We have been talking about the possibility of a large jointly sponsored immunization clinic that will serve the general public. Again, I do not speak on Biden's behalf. I only speak on the health department's behalf. But we have the ability to complement their deficits. They feel that they would be short on administration staff, but have adequate support staff. We have worked to rectify some of our clinical staffing issues with support and do have a fair amount of clinical staff available to us right now. So we feel that we could partner with them in helping to provide immunizers if they could provide some of the wraparound services. So those discussions are ongoing. We've also had discussions with the manager about potentially the health department standing up its own freestanding site external to the health department building at the government office complex. Additional ECU assistance. First, let me say thank you to Chancellor Mitchelson. Ron Mitchelson and I have developed quite a relationship throughout COVID. He's a fantastic individual and has been a fantastic partner throughout this adventure. With the approval of the Chancellor, the following support has been made available to Pitt County Health Department. We've received nurses from the ECU College of Nursing, both faculty, and there's the potential to use some of their higher grade students as well. We have received 3 nurses from the ECU Student Health Service. They will work in our vaccine clinic on Monday to help us with that operation. And then the previously mentioned mobile vaccine teams that Dr. Shackelford and I are working on. This afternoon, earlier this afternoon, I met with my nurse and other representatives of the City of Greenville Clinic. The City of Greenville has its own employee clinic on Brownlee Drive. It's been there since 2017, I believe, is when we opened that clinic. At the time, I was still with Vitanak Health and used to serve that clinic. We have worked, talked to their new medical director, Dr. Terry Berry, and he is willing to allow them to conduct vaccines at the city clinic. We would like to use the city clinic to help us cover eligible firefighters from Greenville Fire Rescue. And as we move into the other phases, they're transit workers and police department officers. And that would help to decompress the clinic time and clinic space at health department sponsored operations. These employees are also very comfortable using the city clinic. The full-time nurse there, Carol Russell's an excellent nurse, has quite a rapport with the city employees. now after 3 going on 4 years of clinic time with them. And this would be a win-win for both the health department and for City of Greenville employees. It will help increase clinic capacity at the health department. And again, this is pending available vaccines. So right now we're talking about relatively small quantities, although our allocations going forward are somewhat unsure as to how many doses we will be receiving each week. Some of the challenges that we are experiencing with the COVID-19 vaccine program. Fully staffed Pitt County Health Department is about 130 full-time positions. We currently have 21 vacancies. That's about a 16% vacancy rate. We have 7 public health nurse positions vacant. We did start 1 new nurse on Monday, so I guess I would actually take that down to 6 this week. Although she is very new, she had been one of our contact investigators through CCNC and liked our work environment and felt like she wanted to join us full time. And I'm happy to report that she did join us. We have 2 nurse practitioner positions vacant. One is a new position created at the beginning of the last budget year. The other one is our now former senior nurse practitioner, Sandra Parks, a wonderful lady who retired at the end of December. So we do have 2 vacant nurse practitioner positions. Early in the course of COVID, our previous preparedness coordinator left us to move on to a position at ECU. This position was filled recently, I want to say back a couple months ago now. It's hard to tell in COVID time. Sometimes I'm not sure what day it is in COVID time. With an excellent but inexperienced candidate, but she's a dynamo, and she is doing a very terrific job for us. So shout out to our preparedness coordinator, Abigail Hubbard, for jumping in with both feet on this work. We at the health department are also subject to the wrath of COVID. Many of my staff have been in quarantine, some of them more than once. I believe 2 of my interpreters have been in quarantine at least 3 times since COVID began because they are so intimately involved with patient care and in working with our clinicians that if a patient turns up positive or one of our clinicians turns up positive, they unfortunately are in the line of fire from a COVID standpoint. A number of my staff, including myself, have had COVID. With one exception, we may have had 1 in-workplace transmission, although I'm not 100% convinced on that. Myself and other staff, as far as we know, it was all acquired outside of the health department and was not line of duty or work related. This week, we have 3 employees that are out with COVID or in quarantine for COVID. 2 of our employees tested positive, and another employee is home because of a family member who tested positive. Last week, we were forced to close our laboratory, which severely hampered our clinical operations because of a case in one of our laboratory employees. And again, our laboratory staff have been forced into quarantine probably at least 3 times, maybe more, because of exposures from clinicians or fellow laboratorians. So pun intended, we are not immune to the effects of COVID or the risk of COVID just because we work at the health department. The COVID Vaccine Management System, or CVMS, is a new system released by the North Carolina Department of Health and Human Services on December 10th, 2020. It has limited access in terms of what they call managers, so we are allowed 2 per health department, I believe, at this time. It has had multiple upgrades since its release. Many local health departments, including Pitt County Health Department, are struggling with this system. We are behind in our data entry. This is really a two-part process to do this. There is an ability for walk-up registration now, although we have not used that walk-up registration function yet. But prior to them making the walk-up function live, we had to upload names, emails, phone numbers into the system in order to register that person in the system prior to being able to document their vaccination in the system. And that required us to, since most of these folks are not our employees, to obtain that information, get it into the right format, and then upload it to the system. Those bulk uploads could take sometimes a few days for them to become active in the system. So as I said, we and many other local health departments are struggling with the use of the COVID Vaccine Management System, or CVMS. Vaccine redistribution. At this time, we can only redistribute vaccine to another certified vaccine provider. The only other certified vaccine provider in Pitt County is Vidant Health. We can adopt, and I know I can't see Madam Attorney's face right now, we can adopt other entities and use them to provide vaccines on our behalf with a relatively simple agreement. As long as we are not transferring them to a third party, they can be considered our surrogates and administer vaccine on our behalf. And we have and will do that, or have not done it yet, but we will be doing that as we go forward. Other providers in the community can begin signing up on Monday, the 11th, to become registered COVID vaccine providers in the CVMS system. But at this time, these providers will not receive vaccine directly from the North Carolina Department of Health and Human Services. They will need to receive that via transfer from another certified provider. And right now, that would be either the health department or Vidant Health. Potential costs. The COVID-19 vaccine itself is provided to vaccine providers at no charge. This was purchased with federal dollars under Operation Warp Speed. Ancillary supplies, not including Sharps containers, are provided at no charge. We do have to provide our own Sharps container and needle disposal service for the syringes. But the Band-Aids, alcohol preps, needles, syringes, those sorts of things are all provided to us at no charge. We have gone out and continue to use contract nursing staff who assisted with our testing program. One of the things that we struggle with a bit with our contract staff is they don't always have availability during the weekday or during our normal business hours because they have day jobs themselves. But this also provides us with the potential opportunity to do some weekend work for vaccinations with COVID and other conditions. We actually are doing a flu vaccine clinic this coming Saturday with contract staff. There will be a security cost. We use Pitt County Sheriff's Office for security. So that's a county-to-county transfer of funds and is a flat rate per deputy per hour. We may need to purchase some additional equipment for a larger distribution center should that happen as we move forward. Additional funding. There was a mention on the state call this week that there is some additional funding coming from the North Carolina Department of Health and Human Services. At this time, there were no details provided as to the amount and or conditions that would be placed on that funding, but that is destined to help with COVID-19 related activities. Our needs going forward. Additional staff, we really need to fill our permanent positions that are vacant at this time. We need an ability to easily contract with staff, and that's pretty good. We developed that nursing contract last summer, and that seems to be working pretty well. We need to make sure that ability stays with us. We need to expedite our volunteer process so that we can accept volunteers who are medical providers in the community willing to assist us with this effort that is underway. We really need to look at how do we provide liability protection for our volunteer staff. We have opted in the short term to pay the volunteer nurses a small stipend to cover a personal liability policy for themselves. But we may want to look at some way of indemnifying that staff for potential liability if involved in these operations. I have found from myself, normally this is a dual role job. I am the health director and the medical director. And in non-COVID times, that is generally a very doable thing. In COVID time, there have been great demands on the medical director side of me to support local physicians, to support our clinicians, to make clinical decisions in regarding COVID. It would be helpful to have a part-time or potentially a full-time deputy medical director to assist with some of that, even if that was only for the duration of COVID. The other thing that we find we struggle with, many times we are asked questions in terms of how many have you done, who have you done, what are the demographics of those individuals, what are the rates. Myself and many of my staff have spent time hand counting cases doing these calculations so that we can report these out to our political leadership and our Board of Health leadership. Having a data and analytics group within the health department is on my list of long-term goals, my strategic plan for the health department, and I would ask for your support as we move forward in trying to provide some positions to be data and analytics personnel for the health department so that we can help tell the story of the good work that we do. The other thing that we need, and this is really not at local control, is the ability to easily and rapidly redistribute the vaccine to other providers. Normally with the distribution of what we would call a medical countermeasure, the vaccine is a medical countermeasure for COVID-19. We would like to exploit or use existing medical infrastructure in the community. And normally we can say, how many doses do you need? And we can push that countermeasure to that infrastructure and let it distribute it for us. That is a force multiplier for us. It broadens our footprint. It broadens the footprint of distribution. The current state rules limiting the redistribution of vaccine make it impossible for us to give this to other providers in general, to just transfer it to them without adopting them. Maybe there's a better word for that, Janice, into the Pitt County Health Department fold. To do that. Many of our 75 and older group, it would be great if they could get this at their own doctor's office and not have to come out for it. But right now I can't just give it to a primary care provider and let them do their 75 and older population because they're not registered in the system. So that is a struggle for us, and not something we can fix at the local level. That'll have to change at the state level. That concludes my prepared remarks for you. I'm happy to entertain your questions or have a discussion with you, and I will stop sharing my, cancel that. I will stop sharing my screen so that you can see me and I can see you. I thank you for your attention.
I see Commissioner Albright's hand.
Yes, thank you. Can you hear me?
Yes.
Yes, thank you, Dr. Silvernail, for your report and for your steadfast diligence, and to your staff. Can you say real quickly how you are doing and your other staff who have been impacted personally by COVID?
Thank you, Commissioner. I am, I think, mostly back to, I will say baseline, because nobody's ever normal. I probably wasn't normal before I had COVID, but I am mostly back to baseline. My stomach has still remained off. It's hard to say if that is still from COVID or if that is just stress, but I am mostly back to baseline, with the exception of our 2 employees who are out on COVID this week. Thankfully, as far as we know, mild illness, and neither of those are hospitalized. Our staff have all recovered and recovered well, and have returned to work and are productive back at their normal jobs.
Okay, thank you. Just a few questions here, and I'm taking notes, and I might have misread some of these. But I believe on Monday you start with 224 doses, and I'm wondering, and they're all spoken for. What happens Tuesday, and how long does this go on?
As we put this out, Commissioner, this was a one-time clinic until we receive resupply. We once we know what our supply is going forward, we will schedule additional clinics. But until I have that information, I can't schedule the next one until I know how much vaccine I'm getting next week. And it's almost going to have to be a week-to-week sort of thing, day-to-day sort of thing. At this time, the allocations come weekly. We received 900 the first week, 400 the second, only 100 this week. And if I run through that, yeah, we've given about 700 by the time we finish work today. I really have 300 or more that should go to the long-term care facilities. So if I just use 300, that gets me down to 400. Take another 224 out for Monday's 75 and older clinic. I'm down to 176 vaccines, and we have vaccine promised for our clinics during the week next week. So I can very quickly be underwater in terms of vaccine supply going into our clinics next week, depending on what our allocation is. So we will likely dip into that long-term care supply in the short term until we're resupplied so that we can do the 1A clinic and that 1B clinic for 75 and over.
Yeah. This is, I guess, they're sort of related questions. Do we have an idea of the 75 and older population? And I'm especially curious about the very long list in that second group. If we have an idea of the numbers that we're talking about, this sounds like an extremely daunting task that you're being asked to perform for us with a lot of people and not much resource.
Yeah, Commissioner, these numbers are shocking. Fortunately, the one thing that will help us get through this until the vaccine is more plentiful and more broadly available through other community providers is that the uptake is only about 30% to 40% in most groups. We're not sure in the 75 and older group yet. When we look at Pitt County, I thought the number was a little bit lower, but in discussions with a colleague at Vidant last night, they had done some research and they feel that the population, the percentage of our population is 5.4% 75 and older. So that really puts us north of 9,000 individuals in the county who are in that 75 and older age group right now. So if a third of those were to accept the vaccine in the first round here, that would still give us about 3,000 individuals seeking vaccine at this time, which is far in excess of the supply that's available.
Yeah, this is maybe too far in advance to even wrestle with this next question, but maybe something to think about when we get around to the second group. That's the large numbers of people that not the 75, but the different professions. Are those prioritized at all? How do you plan on going about, say, confirming that someone is a food worker or an educator, or how do you work? How do you think about that kind of distribution?
We will, at least with the school district, we will work with the school district to identify their employees, and will likely conduct some clinics on site at the schools, perhaps using the school nurses who are under my medical direction as the health director. So at least for Pitt County school employees, that's not too much of a stretch. The other childcare workers across the many private daycare centers and private schools in the community, we may need to ask for some sort of employee ID. I'm not sure that we can, though, legally ask for that ID based on the rules. We may have to take people sort of on the honor system that, yes, I'm in that group.
So is it possible within that group that priorities could be established so that where you know for sure, for example, that someone is teaching and that you're having a clinic, could those be sort of moved towards the top of that group of people?
Yes, we could work with them, and we have. I'm sorry for the feedback on that. I don't know if it's my computer or somebody else's. We have done that already within the 1A group. Initially, one of the local medical practices handed us a list of 600 individuals who they felt needed vaccination. It was essentially all of their staff. And we said, listen, we can't give you 600 vaccines. Can you tell us, pare this down for us some? Can you give us the folks who are working your COVID testing line? Can you give us your providers who are doing outpatient COVID care, outpatient COVID evaluations? And we were able to take that 600 person list and make that a 43-person list. So we have reached out in these cases, at least in the 1A group. We haven't started working that 1B group 2 yet. We're doing some of that with the police department, the sheriff's department. We may need to do some sub-prioritization within that group and say, give me your road deputies first, before you give me your dispatchers and things like that, so that there's some sub-prioritization within that group. And those we'll try to make those in concert or in conjunction with the employer, because the employer should know the employee's risk better than we do, and we'll accommodate again as many as we can based on our supply available.
Yeah, thank you. Last question. Sort of a depressing list of your needs, and I may say that only because they're so dire. What can we as a board do to help you here? Are you asking us for permission to try to hire a deputy medical director, or is that something that we need to address pretty soon? I guess I'm trying to say, please be direct if these are needs that we need to address.
Well, we may even be able to find a retired physician willing to serve in that capacity as a volunteer I don't necessarily have anyone in particular in mind right now, but it would be helpful to have another MD in the mix here, especially being down the 2 nurse practitioners, as I get pulled in many directions every day. Prior to the availability of vaccine, I felt like 10,000 things went through my head every day. And now I'm probably at the 100,000 things going through my head every day. It has been a challenge, and I could probably use some support with some of those things that require clinical decision making beyond myself. Dr. Hardy's a nurse practitioner. She does what she can, but there are some things that need to rise to my level. And Dr. Hardy tries to shield me from those things when she can, but sometimes even she needs to come run things by me in regards to the vaccine and clinical situations that come up regarding COVID.
Thank you, and thank you again for all of your work and the folks at your department. Yeah, thank you.
You're welcome, Commissioner.
Okay, I see Commissioner Nunley's hand.
Thank you, Madam Chair. Thank you, John, for Dr. Silvernail for your talk. And I'll just start where Alex left off. I think, aside from not being able to squeeze water out of a stone to get more vaccines into the county and to the people that need them, and obviously we need to keep pushing that as much as we can from a policy standpoint, getting that here when we can, and we'll continue to sound those alarms to hopefully help you. But with this deputy position, Alex touched on it. Does it help you for us to authorize, and Scott, this is maybe a question for you too, do we have the ability to, is it your recommendation that we authorize free up funds to help Dr. Silvernail out on this front?
Let me unmute myself. The board can authorize a position and appropriate the funding. I'd like to kind of hear from Dr. Silvernail if he thinks that's something he would need immediately, or do you have this volunteer, and could you onboard this in enough time to help with the vaccine distribution?
Yeah, I was really trying not to ask for money and not look like I was begging today for money. Surprisingly, funding has not been a terrible issue through this, with the CARES Act funding, with additional funding that's come down through NCDHHS to us. We have been able to supplement salaries, different things like that. We have hired some temps to help with our screening at the front door. We've purchased equipment that we've needed. Funding has really not been an issue. Most of this has been about manpower or people power. And as I said, given the load that's on us from a clinical standpoint, it would be good to have some help. The ECU project may open that door to having some support through ECU faculty members. That could be done at low cost or no cost. So I'm not necessarily asking for that position today, but at least the potential to consider in some way either deputizing someone to assist or perhaps throwing some sort of a stipend at someone to assist with some of that clinical decision making to decompress the load that's on me on a day-to-day basis.
Well, I just think, I hope that, you just lead us to where we need to be in order to help you the most that you need in this time, because it's certainly daunting. So that'll be all of my questions, but it sounds like we just need to be on standby and ready to help you when you need it. So.
Thank you. We have McLaughlin and then Colson.
If you'll unmute yourself.
Can you hear me?
There you
go. Thank you, Madam Chair, and certainly thank you, Dr. Silvernail, and your staff for doing such a great job. Continuing on the subject of your needs, personnel need, Dr. Silvernail, what is the most critical need that you are in need of now, most critical position? If you would have to name one, what would that be as of right now?
Thank you, Commissioner. I think right now, probably the most critical thing would be to replace one of the nurse practitioners. That has really hampered day-to-day operations, and it has pulled Dr. Hardy, my nursing director, from her director role into being a clinician role. Yesterday, I was working the COVID clinic myself, which I'm happy to do, enjoyed it. But it also takes me away from answering other people's questions and meeting other needs. So if we had another nurse practitioner on board at this time, that would help. It would split the load over 3 people instead of over 2 people, and get us more time to do the administrative and leadership tasks that we have in front of us at this time.
Okay, thank you very much. And I think our manager and the other Board of Commissioners members heard you clearly on that. The other question that I want to ask you, Dr. Silvernail, you mentioned that Vidant Health was the only one that received the vaccine thus far. My question is that, was there a coordination problem? Why haven't you, the health department, received any vaccine to start this process?
Commissioner, we both have received vaccine. The allocation is based on the county's population. And as I understand the allocation process, 60% of what the state determines our allocation to be goes to the healthcare system. 40% of that allocation goes to the local health department. So we have both received it, but at this time, only Vidant Health and the health department are COVID vaccine providers in the eyes of the state. And we can't redistribute the vaccine to entities that are not COVID vaccine providers. So here we have a state-run medical school here, a large state university. Our ECU physicians is not yet a COVID vaccine provider in the system. They can apply on Monday, and I know that Dr. Fultz, the medical director, is planning to apply on Monday. I'm not sure what the turnaround time will be, but even once they're approved, the only way for them to get vaccine will be for a Vidant or myself to push vaccine to them. And I believe Vidant is ready to push vaccine to them once they are approved as a provider to help with getting the balance of their staff done. And then there's also we need to do some of the health science students who are working in COVID units and with COVID patients to get them done. And we may be able to get them to do the dental school faculty as well. So we both received vaccine, but Vidant has received more than the health department, and that's based on the state's distribution plan.
Right, and you're beginning to distribute these vaccine would be where? Was that January 11 or the?
To the general public, our first public distribution of vaccine to people who are not healthcare providers will be on Monday the 11th. Yes, sir.
Okay. It just seems like it's a time delay in that process, because of the devastating effect that COVID is having on the citizen of Pitt County. I would hope that you would have been able to put these vaccines in arms as soon as Vidant was able to do that. But that's another subject, I guess. But again.
Vidant actually got the vaccine about 10 days before we did. They were a week to 10 days ahead of us in receipt. The hospitals received the vaccine the week of the 21st, and we didn't receive it, or the week of the 14th, excuse me. We received ours the week of the 21st last month.
Okay. Again, thank you very much for what you're doing and your staff, and continuing the great job. And Scott, just a final question. I think you probably heard the most critical need that Dr. Silvernail mentioned. I think that as we and Madam Chair, that we can look at this position that he mentioned. I think that would be helpful in going forward. Thank you very much.
If I can address that, I think the position is out there and he's recruiting for it. He's recruiting for 2 of those nurse practitioners. I think the issue is finding the candidates to apply and then be able to accept a job offer. Would that be a true statement, Dr. Silvernail?
Myself, I'm muted. That's correct, Commissioner. We've had 2 candidates that we offered the position to. Both of them had very high salary demands. far in excess of what we thought we could pay for the position. One of those salary demands was in excess of $25,000 more than what we thought the position should be paid, on our county pay scale. The other one, I think she wanted even more than that. She'd come from a very high paying job. And while she wanted to do public health work, she wasn't willing to accept a public health salary.
Okay, thank you very much.
Thank you, Commissioner.
Commissioner Colson?
Dr. Silvernail, it's my understanding that you're supposed to have 2 doses 28 days apart. Is that correct?
That's true, Commissioner.
I'm sorry?
That is true.
Okay, so how do you plan to coordinate them? Will that mean in 4 weeks that there's going to be a lull where new patients, not new patients, but new people will not be able to get shots until they catch up in 28 days for the ones that initially got it?
That will essentially double the workload. Yes, Commissioner. We are right now, as people come through, we are booking them for their booster dose. Initially it came out as very hard. Day 0, day 28. We understand that you can't necessarily get everybody back on day 28. And as with many other vaccines, it's now being said it's important that there be at least 28 days between the first and the second dose. So if we're a few days off of that, that's fine. But what we are doing is going forward, if you had a vaccine with us today, we would book your booster appointment 28 days out, or the next available clinic that's at least 28 days out going forward. So that will, going forward, that will cut into capacity for vaccine delivery in those settings. Really what needs to happen, and I know this wasn't your question, Commissioner, but what we need to do is get to the point where we can spread the burden of vaccination across the medical community, much as we've done with testing. When I do my report for you folks on Monday night, I'm going to show you our testing numbers, and they are off the chart in terms of the number of tests being done across Pitt County on a weekly basis. 1 week we were north of 8,000 tests. That's fantastic. And that's with the health department slowly having withdrawn from testing in the mid-December, or at least routine open testing. So I think that what has to happen with vaccination is that we need to be able to spread the burden of vaccination across the medical infrastructure that we have. We have enormous medical infrastructure, and we need to be able to spread that burden across that infrastructure so that no one agency or that the hospital alone doesn't have to bear that burden, because the time to do these number of folks, given the capacity, given that we have to do these vaccines in the middle of a pandemic where we still need to maintain social distancing as part of patient safety, it really limits capacity to get people through these clinics. And so the answer to our problem is to spread this burden across the medical community and not leave it with my agency and Vidant Health.
No further questions.
Thank you, Commissioner.
Dr. Silvernail, do you hear me?
I do. Sorry.
Okay.
I muted myself.
Okay. What should citizens do? What is the plan for citizens in order to get the vaccine? Should they start calling now, or when did you open the hotline to take appointments for the 224 doses? So I know you said that you will be getting a supply every week, and you will not know how many doses you will get each week. But so what should the citizens know as to how to or when to call, or to set up an appointment for when the next supply come in? So how does that work?
Mm-hmm. We will notify folks as we do across all our media platforms. I'm going to let Amy who's still on the call, I'm going to let you explain how that registration process worked today.
Today, when we were sure that we were actually going to be able to make the clinic happen on Monday, we sent out a press release at noon and let the public know what number to call. And we had 7 operators on the calls today, and we filled up those 224 just before 3 o'clock today. So it was very quick. Since we do not know the amount of vaccine we're getting and when we're getting it, we have to plan, as Dr. Silvernail said earlier, day by day. And we also have to plan in coordination with the state's guidance as to who we can vaccinate when. So we'll have to continue to send out releases to the media, letting the public know what group is eligible to get the vaccine at that particular time and when we will be able to provide the clinics for them. We'll also continue to put it on our website and send it out through Facebook as well.
And you're advertising on, when you say media, TV and newspaper as well?
Right. All of the, when we send out the news release, it goes to all media outlets. And from my understanding, I really didn't have time to look to see who picked it up today because I was in the hotline room. But according to our callers, it seemed to be on every TV station and local newspapers as to where they had heard about Monday's clinic.
Okay. Because I heard about Greene County before I heard about Pitt County. Yeah.
Yes, and we did not put out a news release until noon today because we had to be sure with the amount of vaccine that we had and how many we could do on Monday.
Okay. All right. Commissioner Ward, you have a question? Can you hear me?
Yes, I can hear you. Can you hear me?
Yes. Go ahead.
Well, she may have answered some questions that I had. One was, I wonder if we could give the number to call even now, because I do know a lot of people watch this and the repeat of it, because I'm getting a lot of phone calls. I don't know about the other commissioners, and I think they are, and I don't really have the answers. And many times they want to know, how do I make an appointment if I'm 75 or older? Where do I call? And I don't know. I have no idea what to tell them. So, and even though it's up on the website, I think maybe we could do a better job, maybe putting it out. Maybe we could help on our TV up there, like what we're doing now, and we can project it because people do go to that website a lot. And I think that may, how about the county office? There's so many people in the county office that are not necessarily health workers, but we're having to see people that come in all the time, and not we, meaning me, but the people in our county office, in the payroll department, all of them. And I wondered what the possibility that they could get on the next go around of immunization, since they are exposed by a lot of the public coming in. And I think maybe that's it. But I do think we need to have this number to call to see about setting up an appointment, and when can they set up an appointment. It needs to be somewhere besides just on the website. And I haven't seen it in the paper. I mean,
I have not either.
It may be online on the paper, but I'm still one of those who holds the newspaper and reads it. So I think that was it. But I would like for us to think about those things and maybe get those done if that's possible.
And Commissioner Ward, we have put it in the paper on numerous occasions within the articles that have been reported. The number is our main number, which is 252-902-2300. And then there is an option 4 that takes the public directly to our COVID-19 hotline. Okay. And we've been running that since March. We are now having over 200 calls a day. We have 4 operators, and we may need to look in expanding and adding some phone lines because the calls, some are going to voicemail because we do not have the number of operators needed to answer all the questions. And right now the questions are taking quite a bit of time because there's a lot of questions about the levels and the phases of who can get the vaccine. So we're on the calls a bit longer, not able to free up the time. And so we're also having to return voicemail at the end of the day. When I changed the greeting on the voicemail, which we've been trying to do daily, within 10 minutes, we had 41 messages just in the time it took me to get a new message on there. So we are looking at probably having to expand if that is possible in our hotline room.
Amy, repeat the number again.
Is 252-902-2300, and they would press option 4, and it takes them directly to the COVID hotline. And if when they call the 2300 number, if they listen to the entire menu, it will say to reach the COVID-19 hotline, press 4.
Thank you.
Well, my point is we're talking about, I don't think the public is getting all this information, like this number, for instance. And I know you all have done everything you feel like you possibly can. So what I'm saying is if anyone else has an idea about how we can get this out, and like I said, I've had a lot of people to call and just a simple question of, I'm 75 and older. How do I get an appointment so that the next time things come in, because we're saying again that it's going to be by appointment only. So I think some of that needs to be clarified and needs to be put out there more so the public can know when they need to call and make those appointments or whatever. And
we'll work with our county Office of Public Information to try to make it more widespread. And we probably will have to stick to appointment only, simply because when we did the math of how long it would take us to do the vaccine, how many every 15 minutes, some of these individuals would be in their cars for as much as 7 hours waiting in line. We knew that could not happen. So we had to resort back to appointments.
Well, I know this sounds far-fetched, I guess, but I was wondering if there was a large enough place. I know that we've had some big box stores to close down and they're emptied. And I wondered if there was a way that maybe we could, or a gymnasium somewhere where we could set up numerous stations with, and even keep by appointment, but be able to, call in people to help you. And when the time comes when we do have access to the vaccines, I'm not being critical at all. This is the most unknown thing that any of us that I've ever dealt with. And I dealt with a lot as a school principal, but nothing similar to this where you really don't have any control and you're waiting to hear and you don't hear and you keep pestering and hoping something will happen. But I do want you to know that the county commissioners support this. I want us to move on, like Ms. Albright said, I want us to move forward with finding somebody to help Dr. Silvernail almost immediately. If he's got somebody in mind, I say go get him. The salary is open. Pay him whatever you can pay, but don't go after. Go find somebody that's retired who will be willing to come for the salary and not ask for an exorbitant salary. But get the help you need and let us know if there's anything else we can do on this end.
Mr. Ward, we are working with Dr. Silvernail to try to locate different options for him to do a big box operation per se in vacant space. Our county engineer is working with brokers, real estate brokers per se, trying to find adequate facilities that Dr. Silvernail would find adequate as well. And it would be properly located, parking, space, bathrooms, heated, cooled, and so forth.
Right. Good. And I just think that kind of needs to be said, Scott, and thank you for sharing that we are actively looking and moving forward with that, because that's the kind of call that I'm hearing, and hopefully a lot of citizens will hear this and, and know that everybody is working as hard as they possibly can. Thank you.
Commissioners?
Commissioner Perkins Williams.
Oop.
You have you want to make a comment?
Yes, Madam Chair, if I may.
Okay.
Commissioner Ward asked about the county workers. The ACIP, or Advisory Committee on Immunization Practices, was mum on government workers. They listed those groups as we defined earlier. Some of the individuals that Commissioner Ward described would count as essential workers and would be eligible for vaccine under the phase 2B or phase 1B group 2 guidance from the state. So our client facing staff, some of our social services staff that go out and do child investigation, custody investigations, those sorts of things, they would be eligible under that group 2 listing of folks. So we haven't forgotten them. And Jan Elliott has tapped on my shoulder figuratively or poked me a little bit to say, hey, when can we get our vaccines? And so we have that in mind when they become eligible under the state guidance. Again, it comes down to how much vaccine we have available to do that. We were not expecting to push into the 1B group until early February. We're because of the demographics of Pitt County, with the medical center, with the medical school, with so many medical facilities in the county, we have a very, very large group of 1A folks, healthcare providers, also including behavioral health. I had a behavioral health group reach out to me. Very important, especially now. We know that COVID's taking an enormous toll on our mental health as well as our physical health. And it's important that we help protect those providers. While some counseling services, psychological services can be delivered by telemedicine, not all of these folks have the ability to do that in their practice. And not all patients are open to telehealth visits for these things. So we really want to try to get the medical community protected so that they can continue to serve our residents moving forward. If we don't protect the protectors can't protect the people they need to serve. And our frontline county staff, our client-facing county staff would be in that group of frontline workers as we move forward, Commissioner.
Okay. Commissioner Perkins Williams, you have a question?
Yes, thank you, Madam Chair. Dr. Silvernail, my question, appreciate the report and your sharing about the fact that you did receive some Moderna. On the news, we hear of 2 vaccines. Are you expecting both of them, or are you, is it that we're gonna get just the Moderna vaccine?
Good afternoon, Commissioner. We received only Moderna and will likely receive only Moderna because of the handling issues. We are able to store the Moderna in our freezer and our refrigerator. The Pfizer vaccine does require the extreme cold chain handling, which is the -80 degrees handling, and that has predominantly gone to hospitals. There were 3 health departments in the county, or in the county, 3 health departments in the state that received Pfizer because they were able to meet that cold chain demand. And they were in the Piedmont and more the western part of the state, some of the larger counties. Biden Health has received Pfizer, predominantly Pfizer. The bulk of the allocation to them was Pfizer, with some Moderna going to them as well. But they did receive predominantly Pfizer and have been using Pfizer for their employees. Excuse me.
My other question, are you going to, how do I phrase this? If a resident desire a particular vaccine, are you able to allow them, or are they allowed to call the source of the vaccine that they would like to have?
I suppose right now, there's nothing saying that someone has to get one vaccine over the other. It would come down to what the provider had available. So if somebody wanted Pfizer, they could find a provider who had Pfizer and receive the Pfizer versus the Moderna. There's also an AstraZeneca vaccine that's been under development that's not approved yet, that may come out sometime this year. So potentially we could have 3 vaccines available to us. It really would come down to who has which vaccine. At some point, I believe the federal plan calls for these vaccines to be available through the chain pharmacies, much the way flu vaccines and other vaccines are available at Walgreens and CVS. And there may be some option to choose which vaccine is available at that time. But I would not have the option to give somebody a Pfizer vaccine if I only have Moderna. They would have to go to a provider who would have Pfizer available.
Thank you for that choice, but it may be a personal choice for the particular citizen or the particular resident. That's why I asked that question. The next thing I like to ask you is that if I'm giving care for someone in my residence who is 75 and above, and I do not meet the requirements for age, like I'm 40 and I'm taking care of someone in that age range. So will I have the opportunity to get the vaccine because I'm taking my 200-year-old grandmother?
If they are a healthcare provider, and there's not a distinction there that you have to receive a paycheck for that. There may be some leeway with that, but under the state guidance, which we are compelled to follow, we would be able to vaccinate a healthcare provider. Now, if that is a family caregiver who's not a certified provider or not an employed provider, I'm not sure where that falls in the guidance. I think it may be possible on a case-by-case basis. That has not been asked of me before and is not clearly spelled out in the guidance, Commissioner.
Well, I look at the fact that there are a lot of citizens who take care of the elderly within their family, and that person needs to be as healthy as possible. It needs to be as protected, because the welfare of the family depend on that person who's doing all of the go fetch it's, the run and get, and how about do, and the honeydews. So that's why I asked that question. I didn't get the answer I wanted, and I just wanted you to know that. So, but I did ask the question. The next thing I like to ask you, I try to write it down. You mentioned a position of data and technical team, I think, and you didn't say how many you wanted. And I do know the importance of registering data. So where is data and technical people on your list of needs? Because I hate to bring up, because it's this mutated strain of COVID is out there. And if you don't have technical team to get or register or whatever, or however it's detected, then area people will not know. And that's a regional thing, because Pitt County is considered as a regional land or government or whatever. And that was a question I wanted to ask you.
I would put a data and analytics person or persons. I'm thinking with the amount of data that we need to be able to manipulate and analyze, that we would probably need at least 2 people in that sort of role. And
because the reason I asked that question is because my personal doctor does not call me. It's a machine. And if I don't return the call or do whatever, then I get another call from that machine. And that machine gives me more specific information that my doctor does get a call, and I get an email as well. from my doctor. So those capabilities are out there as far as watching appointments. I'm really see the decision about what vaccine you have. Some people have medical background and medical people in their families, and well, they drop in seeds and seeds sprout. So that's why I was asking about if the people have an opportunity to find out where a particular vaccine is, and if they be allowed to or whatever. But those were the only two questions that I wanted to ask you. Thank you so much.
You're welcome.
Thank you. Commissioner Albright, you have another question?
You're muted, Commissioner Albright.
I'm sorry. Okay. Can you hear me now?
Yes.
I'm sorry. I do have a couple of follow-up questions real quickly. And the first one is related to, I believe I understand in terms of information here, that it will be after February 8th before the general population will be available, before the vaccination will be available to a general population, that we should understand that and quit calling the health department for questions related to a vaccine that we know that we're not available, that's not available to us. And I want to make sure we're clear on that.
The 1B group 1, the 75 and older, are eligible for vaccine beginning on Monday.
Right, but it's that general population. I'm trying to help tamp down the number of information calls. And so people that are not in any of those categories that are just waiting for a vaccine, that's going to be sometime next into February, right?
Yeah, that'll be into what they're calling phase 2, I guess. Commissioner, I don't have that breakdown in front of me at the moment.
So we need to stop calling about that. My other concern here, I guess, and I'm not sure I understood this, but you had 224 doses to reserve, and you had all of these phone calls that happened within a couple of hours after the announcement. I wonder if it's possible, and perhaps you're already doing this, to construct a database of those who have called so that we aren't all waiting if we're over 75 for that announcement, so that we would be in that. It's almost like a lottery to have to wait every day for, y'all don't know when you're going to get the vaccine, but we do hope it will come, so that if we had that list and that there were people on the list that way, they would be prioritized, and it wouldn't be having to wait until they read the announcement from the health department and then start assaulting y'all with all of these phone calls. And maybe that's already been talked about, and maybe it's not practical.
Mm-hmm. We could look at a pre-booking strategy where going forward, we would take a list for the next vaccine clinic and then confirm that list when we open that clinic, that those folks still want it and still are available to come that day. So we could look at a strategy like that, Commissioner. And that
seems more coherent than waiting for when you don't know the vaccine is coming, and then you hear that it's going to come in 3 days, and then you have to start patching together this list of how many people based on how many vaccines. But anyway, thank you again. I'm sorry for the continued questions, and good luck. It does sound way like a lottery right now. And if I understand, 9,000 people potentially needing it and 224 got it. We also should understand, I think, in this county, how desperately we need more vaccines. This is a failure of distribution, and it's a chain that goes way outside of your command, Dr. Silvernail. And I apologize really for the stress that y'all are under for circumstances that you absolutely have no control over, not just the disease, but this vaccine debacle and rolling it out. Thank you.
Dr. Silvernail, I kind of agree with Commissioner Albright or what you said, really, pre-booking, because I think that you would not take care of all of you're not going to take care of all of the 75-year-olds and older when you only have 224 doses, this week. So in order to keep making appointments for those 75 and over, then I would think that you need to continue to taking those appointments and pre-booking, as you said. So I kind of see the 75-year-old really kind of stretching right on out into the other age group until you get all of the 75-year and older. So is that, am I right on that? Or
Yes, Commissioner, we can, I will regroup with my team and we can look at pre-booking these folks out and at least getting people on a list, and that may help alleviate some fear in that population that, well, when am I going to get it? Well, at least if I feel like I'm on a list, that there's some progress. And
yes.
as we work our way down that list could easily be in excess of 9,000 people.
Yes.
But we can look at a strategy that will get folks on a list. Again, it would sort of be a first come, first serve. I don't know how else to do it. If if someone calls tomorrow and someone calls next week, the person who called tomorrow would go on the list before the person who calls next week.
Yeah.
But we can regroup and look at a strategy as to how we might be able to accomplish that. And that would probably make things easier for us going forward, in that we can look at the next 100 people or 300 people on the list, and as our vaccine supply comes in, say, well, hey, we're going to allocate this to the 1B list. And as I said, one of the things that we're struggling with is that the 1A list is very, very big given the nature of our community.
Yeah, but our 75 and older are vulnerable, as well as your, the other groups too. But
absolutely, when you look at our data, commissioners, as I've shown you all before, the 75 and older account for about 5% of our cases, but account for in excess of 50% of our deaths. So that is clearly the highest risk group for adverse outcomes from COVID and fatal outcomes from COVID. So if we want to protect life, that's the group that we should target the most. But I am not the creator of the priority system, but I am required to follow it.
Yeah. So we're not going to stop seeing or giving it to the 75 and year older once we move into the other group.
No, the idea as we progress through this hierarchy that's been developed is that hopefully at each lower level, as we move down that hierarchy, and I know you can't see my hand moving, that there will be, well, yeah, I guess if I get in front of the camera, if as we move down this hierarchy, think about it as a pyramid. At each level we go down is wider than the pyramid above, meaning that the vaccine supply is better at each successive level. So the folks that we didn't get in the level before will have enough vaccine to hopefully catch up some of them while starting the group that is now eligible. And as we move down the pyramid, each level will have a better supply of vaccine.
Okay. Commissioner Perkins, William, do you have another question?
I missed a couple of questions on my sheet. Forgive me, because I like to write them down and then go through all of them. But with this, the caregiver kind of thing, different terminologies depending on who's doing the caregiving, Dr. Sivanel. And then when you're taking care of seniors, maybe more than one, you have to keep a calendar. And if I'm going to take the vaccine and I have to go a different time than I have with the people that I'm caregiving for, then that means I'm going to have to keep more than one calendar. And then if I took my test for the vaccine, if I took my test for COVID, and then I have to make that note, and then I have to go back in a certain time for something else, then things can get complicated for the people that you're giving care to. So that was the reason I asked the question about the caregiver who is seeing to the elderly. That was an explanation. My next question is, are we still doing any tracing? That was the one. I just wrote it down here and I missed seeing it. And you want to see it right there? But I missed I miss seeing tracing because I know I always ask you that question, but it's an important piece for me.
Yes, Commissioner, we are. We have our surge staff from CCNC. We have a additional in-house case investigation staff. What you have to understand is that we are getting about 128 cases per day right now, and the staff is overwhelmed. The ability to investigate and follow up on each and every one of the 128 plus cases a day is daunting, and there is simply not enough contact tracing staff to be able to trace every one of those cases.
Well, I appreciate that. And I just want to say, because publicly, not many people who are fully educated about tracing, when you test and you find a person who has a case and you have to trace it, it depends on the spread, the carrier, and all of that. And a lot of people just may not understand that. So what I'm saying this for is that if you get COVID and you have been in around someone that you know had COVID, what you should do as a carrier or possible person who having a thing, they should at least answer that telephone when your staff calls, because they don't answer the phone and or pay attention to the text message. And that's one thing I hear as a community person. But and I know you can't go as deep as maybe some places, but it is important to know where there are clusters accumulating. So that was my thing with that. And I appreciate your patience with me and my reputation what with the repeating questions. But I got bosses. My elderly children are bosses. And that's the way we have when we have older people in the house. So I just wanted you to know there's a lot of things that relate to the difference of age or the difference of care that you're giving to a loved one. You know what I mean?
Yes,
so it saves when you have to drive 20 miles to get a test for an elderly person. And then you have to go back to get the test and leave that person and wait to get that test for yourself. That's what I'm saying. And I don't know how you're going to solve that, but I'm not in help. Thank you.
Mm-hmm. I think for the family caregiver, it might be possible to review those on a case-by-case basis and approve that individual for vaccination if they are truly caring for an elderly person in the home setting. The guidance does not require that someone be employed by a healthcare firm. It says healthcare provider. So I think there can be some judgment there if someone is truly taking care of an elderly person with dementia or someone who is incapacitated in the home, who is a family member caregiver, essentially doing nursing aid service, but without a salary. The guidance does not require a salary or that they be employed. It requires them to be in that role. So I think we could address that by working on a case-by-case basis. On the contact tracing, you're welcome, Commissioner. On the contact tracing issue, I did want to follow up with you from our previous conversation regarding the text message and automated phone call. That is now part of the state contact tracing tool. So as long as when the case goes into that tool, it has a valid working phone number, that individual will receive an automated text message from the state contact tracing tool. That went live a couple of weeks ago, I think back the week before Christmas.
Thank you so much for that. But when you answered my question about caregiver, I know 3 residents now. One has a dementia person, and you got to have somebody to cover you while you're doing things. And another one has I'll just simply say 100-year-old parent. Mm-hmm. And then there's another one who have 2 people in their household. So a lot of times people have extenuating circumstances. And I'm glad you will look at it when they call on that scheduling of the test. That's, you got to call between 9 and 4, right?
I think that's what we did for today, yes.
So there's no off time calling and then on time 9 to 4 of, I won't say shooting, of doing the vaccination, a distribute,
Yeah,
giving a shot.
we scheduled to try to avoid, people working past what their normal working hours are. So we do try to end our clinic so that people leave the office, at their
Okay.
8-hour mark. I will say we were all in the lobby at about 6:30 the other night with folks that we were finishing up from the vaccine clinic, given that we were running a little late that day.
That's all of them. Thank you.
Okay, you're welcome, Commissioner.
All right. Thank you, Dr. Simler. I don't see any more hands raised. Don't see any more raised hands. And Dr. Harold, do you have any comments you want to make at this time? Are you still on? Is he still on?
He's here, but he's muted. Ms. Dixon as a vice chair.
Hello. I too want to thank and applaud the health department for everything that they're doing in order to respond to the COVID-19 crisis and pandemic that we're in. I don't have any additional comments, but I do want to echo the request of creating that waiting list, because I think in the long run it will reduce the amount of calls that you're getting that are new calls when you can have a more proactive approach to getting people in for the vaccine. Beyond that, I have no other comments. I'm so happy that someone decided to have this joint meeting.
Well, thank you, Ms. Dixon. And we also thank Dr. Harrell and all of the members of the Board of Health who are present on this call, this meeting. And I hope that this helps us to answer questions from our citizens and to be able to get the vaccine into the arms of our citizens. And I was glad to hear Dr. Silvernail say that we have not wasted any vaccine. That's good to know. We don't want to waste any, because I'm sure we got enough arms here in Pitt County that we can put the vaccine into. So if there are no other questions or comments, Mr. Manager, do we have any other business to attend to at this time?
No, ma'am. The purpose was really just to bring two boards together to disseminate this information and to make sure that I do want to give Dr. Silvernail kudos for his, I think, weekly press conferences that he does with the press, and he covers a lot of information, but sometimes I don't know, the press will cover certain portions of that. I thought it was important for both boards to hear it directly from the horse's mouth, what's going on, and I think this has proved productive and useful.
I do want to say, along with some of the other commissioners, want to address the needs that you put before us. We heard you, and we also heard the manager say that he is working with you on trying to fill some of those positions, especially the nurse practitioner positions. So we're looking forward to getting that done. So at this time, I will entertain a motion to adjourn.
I so move.
A second.
Okay, it's been moved in second. Madam Clerk.
Chairwoman Floyd Huggins,
Yes.
Vice Chair Fitzpatrick,
Yes.
Commissioner Albright,
He said, yeah.
I'm saying yes. Yes, please.
Commissioner Colson,
Yes.
Commissioner McLaughlin, Commissioner Nunley,
Yes.
Commissioner Ward,
Yes.
Commissioner White,
I think she had to, her battery was dying on her phone. She had texted me, so she may be off the call now.
okay, Commissioner Perkins Williams.
Yes.
Vice Chair Dixon,
Yes.
Member Garrison,
Yes.
Chairman Harrell,
He may be with the patient, our PIO was telling us.
okay, Member Pack Smith,
Yes.
Member Spate,
Yes.
and Member McIntosh.
Yes.
Motion passes unanimously, and motion to adjourn at 4:45.
Okay. Adjourn.